Okay, let's finish off this set of material by having a little bit of a look of clinical case studies. So this is your chance to really play the doctor if you wish so. Using clinical case studies is very common in medicine. In fact, we do a lot of training using PBL, problem-based learning approach. So what we're doing here, we're really wanting to work from the data and reach conclusions that are backed up by evidence. So let's have a look at the process a little bit. What's involved when you get a clinical case study? How could you potentially approach it? So on these case studies, the big goal of what we're asking for you is to show how you come up with a conclusion. So we're looking for that clear chain of evidence that feeds into your conclusion. Sometimes when I'm grading student work in case studies, it's not necessarily as much about just the final conclusion as it is the student demonstrating what led them to that answer. So the process of coming up how to tackle a case study really starts with the background. So you do need to analyze the scenario that you're given. Sometimes this involves investigating the problem a little bit more. For example, doing outside research, trying to find those connections with the material that we've been covering as it relates to that case study. The next thing that's important in the process is to examine the different alternatives, whether it's for the solution for the case scenario that we're looking for, or whether it's asking what could be the potential causes for what we're seeing in that case. So again, it's all about appreciating the fact that sometimes there's multiple explanations, and the job really here is to come up with an answer, but come up with an answer in a way that makes sense. So while we are asking for the most likely cause or most effective solution to solving that case scenario, it's all about that supporting evidence, verbalizing your rationale. And this is what we do in medical field a lot. We want to make sure that we can justify how we came up with the answer that we came up with. Remember, there is legal accountability also in the medical field, so we don't just want to make decisions that are pulled from the thin air. We want to show the rationale and show the reasoning for the decisions that we're doing when we're doing patient care. So here I have listed really key steps of how I would encourage you to approach the case scenarios, and especially on this class, what might be the most effective way. So the first step is to read and examine the case very thoroughly. So you will be provided typically a paragraph's worth of material. Sometimes it might be more, sometimes it might be less, but really carefully teasing out what's important from there. Sometimes this might also involve looking at multiple documents, but you want to go through all of that. And why we want to go through all of that is to identify the key items. So at this level of study, there's probably going to be somewhere between 2 to 5 key items that we want you to focus, whether they're problems, whether they're pieces of information that are crucial for that case. And we always want to think how they impact that case. Sometimes these might be signs and symptoms, sometimes these might be other questions. But we try to keep it fairly manageable. At this point, I probably should also mention that sometimes there are distractors in the case studies as well. So not everything is always relevant to the question that you're being asked. So really these steps of approaching it in a systematic manner allows us to focus on what's important to take away. The next step that we're looking at when we're trying to uncover the potential causes or potential solutions to the case study, this might involve really the bulk of the work. Not only have you read through the notes and identified what's important, but a lot of the time there is additional work that's needed in addition. So you might need to do outside study on the content. You might need to try to connect it to the course materials, course readings, or it might require having dialogue if you're doing this case study with other people, what others are noticing. So really the bulk of the work isn't teasing out the key points. The bulk of the work is finding that rationale, finding the data that backs up where you're heading with your case study work. And finally, we would ideally end up with the most likely cause or best solution for the patient. And that alone is not what you're being graded on. What you're being graded on is the supporting evidence of justifying why this might be the best treatment solution, best, most likely cause for the thing that we're seeing. And kind of weighing also that critically there's going to be pros and there's going to be cons for different treatment approaches. There might be for different signs and symptoms typical characteristics and less typical characteristics. So also being critical towards those decisions and those conclusions that you're making is going to be important for us. Now, if we were in a face-to-face class, at this point, I would pause and have students to review an example clinical case scenario here. And what I would ask students to do is, again, identify from the top portion on this slide, what are the key facts in this scenario that we might want to focus on? What would be those elements that we start to build our answer towards? So again, when you read the paragraph in a clinical case scenario, don't just rush in to give the right answer, but first spend a little bit of time identifying what's important, what's characteristic, what's going to help us to solve these questions. So if you want to give it a go yourself in this online setting, you can pause the video now and join me in just a second. And if you pause the video to kind of tease out the key points, let's see what we end up with. And obviously, different people notice different characteristics, different specialists emphasize different items. But on this scenario, some of the things that we might pay attention are: we're seeing that the change on the patient is sudden. So this goes back to the concept of homeostasis. We're always looking for changes in the body. We're also learning that it was a flu vaccine that was administered to the patient. So again, we're seeing what could have caused those changes. We are getting some previous background information. We're learning that the patient is allergic to eggs, and in fact a lot of vaccines are developed from the egg-based products, so that might be something to keep in mind. In addition, what we have here, we have some clinical measures, and we can compare them to standard normal values when it comes to the heart rate and when it comes to the blood pressure. So that might be some of that research that you need to do to compare what's normal and what's abnormal. And from all of this, we could then come up with our answer and the rationale for that answer. So this is going to complete our second video on this set of activities of getting you set up for success on this course. I hope it was useful, and I look forward to seeing you on those discussion forums and interacting a little bit more so that we can really build that community of learning together. Until then, thank you and bye.